おはようございます。
おはようございます。
中村さん中村さん
Cardiac arrest can occur suddenly in the course of everyday life.
大丈夫ですか中村さん中村さん
If life-saving measures are not started immediately after the heartbeat and breathing stop, the possibility of saving the person's life drastically decreases. In Japan, it takes EMS, emergency medical service, an average of 8 minutes 30 seconds or longer to reach the emergency site. Therefore, it is essential that people in the immediate area start life-saving measures as soon as possible. The life-saving procedure has 6 steps. Make sure the scene is safe, check response, call for help, call EMS and ask for AED, check breathing, do chest compression and rescue breathing, give electrical shock by AED.
中村さん大丈夫ですか
Especially in an outdoor disaster, the first priority is to ensure your own safety. If it is not safe, wait until EMS arrives. If possible, move to a safe place together with the collapsed person. After confirming your own safety, call out and tap the patient on the shoulder to check for response.
意識なし誰か来てくださいどうしたんですか
If there is no response, request assistance from people in the area and ask for EMS and AED. The person who has been requested to get an AED should get the nearest AED as quickly as possible.
もしもし救急です。同僚が倒れていて意識がありません。40代男性です。
Check if the person is breathing. Check for breathing by looking for movement of the chest and abdomen. Agonal breathing, like sobbing convulsively, is equivalent to no breathing, so start chest compressions. Start chest compressions even if you are unsure if there is breathing.
呼吸なし胸骨圧迫1、2、3、4、5、6、7
If there is no breathing, immediately start chest compressions. Push down the lower half of the sternum about 5 centimeters. Then release fully so the chest returns to the original position. Continue at a rate of 100 to 120 times per minute.
1、2、3、4、5、6、7、8、9、38、5呼吸
If it is difficult to do rescue breathing, just do chest compressions. One person should operate the AED while another person continues chest compressions.
Adult mode. If patient has no response and is not breathing,
Operate the AED according to the voice instructions.
remove all clothing from patient's chest.
First, remove clothing from the chest. If clothing is difficult to remove, cut it with scissors.
Remove pads from blue liner and apply to right upper chest and left side as shown.
Remove the blue liner from the disposable pads. Apply the pads to the chest position shown on the pads. Continue chest compressions while attaching the disposable pads.
Upper chest and left side as shown. Do not touch patient. Analyzing heart rhythm. Do not touch
The
patient.
AED starts charging energy if it detects a shockable heart rhythm, such as ventricular fibrillation. Ventricular fibrillation is a serious abnormal heart rhythm. Our heart is beating regularly. But ventricular fibrillation causes the heart to beat irregularly and stops pumping blood. Electrical shock from the AED returns the normal heart rhythm. If the heart rhythm is normal, or the heart stops completely, the AED does not charge energy. If shockable heart rhythm is detected, the shock button starts flashing.
Touch patient. Press flashing button. Shock delivered.
お願いします。
It is safe to touch patient. Start CPR.
Continue chest compressions and rescue breathing, CPR, until EMS takes over, or until breathing returns to normal, or until the patient responds. If there is an emergency with a child, use the AED. For children aged 0 to 7, switch the adult child mode switch to 0 to 7.
Response and is child mode. If patient is adult, set switch to 8+. If patient has no response and is not breathing,
Children have small bodies. Make sure the two pads do not overlap or touch each other. If the body is small enough that the chest pads may touch, attach one pad to the middle of the chest and one pad to the back. If someone touches the patient while AED is analyzing patient's heart rhythm, the AED might incorrectly analyze the heart rhythm. If there is dirt or anything between the pad and the skin, it might interfere with heart rhythm detection and prevent electrical shock. If the chest is wet, wipe it dry. If medicine is on the chest, remove it and wipe the chest. Remove accessories from the patient's body. If accessories cannot be removed, make sure there are no accessories under the pads. If chest hair is thick so the pads don't stick to the skin, remove the hair. Do not put pads over the bulge of a pacemaker. Keep mobile phone at least 1 meter away from the AED.